So yes, good evening everyone. This side Dr. Abhijeet, Z-Taj. Yeah, yes, lots of appreciation from Pakistan. Thank you so much for the love and respect. Angel Nagpur, good evening, beta. So welcome to the session, guys. Welcome to the session on yes. We are discussing the cerebrum. Yes, we have started with the cerebrum yesterday, and today is the session two or the part two of the cerebrum. So before starting with the session, guys, just give me a thumbs up in the chat box if the audio and visuals are perfectly fine, guys. If the audio and visuals are perfectly fine, please give me a thumbs up. Yes. Adam Webb, artist, writer, web. Okay. Thank you. Hmm. Chalo. It is for private medical college also. Yes, everything. Good evening, Pooja. Hello. Yes, Malik. Yes. Okay, perfect. So yes, we were discussing. Okay, let us revise what we have discussed yesterday, guys. So we were discussing the topic that is the important functional areas of the different lobes of the cerebral hemispheres, right? Pooja, good evening, beta. Good evening. So let us just start, guys. Let us start. Yes, without wasting much more time, let us start. So we are discussing the important functional areas. Yes, the important functional areas in the different lobes of the cerebral hemispheres. And firstly, we were discussing about the frontal lobe. In the frontal lobe, guys, okay, let us just put the heading also. In the frontal lobe, yes, we have discussed the three, yes, the frontal lobe. Like we have discussed motor area 4, we have discussed the motor area 6, the premotor area, right? And we have discussed the frontal eye field, that is area 8. That is area 8. Now, guys, we are going to discuss. Yes, now, guys, we are going to discuss. Yes, before like starting on with this. Yes. So I hope I'm clear, audible to everyone over here. So please just give me a thumbs up, guys, that if I'm audible, clear to everyone over here, right? Now, yeah, Dr. Akhilesh, very good. Now, guys, in the frontal area, if you just try to look over here, if you just try to look over here, we have this part of the lateral sulcus, guys. This part of the lateral sulcus, you already know, yes. And we have this ascending part. We have this anterior part, और ये जो ऊपर जा रहा है, this is the anterior part of the lateral sulcus. Okay. Yes, Osama, good evening. Sapna Sneh, I'm from Nepal. Namaste, namaskar, beta. So we are going to discuss two important areas over here. Two important areas over here, guys. That is area number 44 and area number 45. Area number 44 and area number 45. It is called as Broca speech area. It is called as the Broca speech area. So if you clearly see this area number 44 and area number 45, we have discussed this yesterday, guys. We have discussed this yesterday. Yes, we have already discussed this yesterday, these areas, guys. If you can just remember this particular diagram, right? So the lateral sulcus has three parts, guys. I have already told you this is the, yes, this is the posterior part, right? If you can just see, this is the posterior part, right? We have the anterior part, and which is going upwards, it is the ascending part of the lateral sulcus, right? So we have anterior, from anterior to posterior, like. So we have the anterior limb, we have the one which is going upwards, it is the ascending limb, and one which is going posterior, it is the posterior limb. It is the posterior limb. Now, guys, you already know, between the posterior limb and the ascending limb, this blue colored area, it is called as pars opercularis. Okay, it is called as pars opercularis, right? So remember, guys, over here we are actually dealing with this pars opercularis where area number 44 is present, right? And we have this pars triangularis, yes, where the area number 45 is present. So pars triangularis, it is between the ascending limb and the anterior limb, and 44 area, it is between the ascending limb and this posterior limb of the lateral sulcus. Posterior limb of the lateral sulcus. So let us just try to write about this. Yes, the 44 and the 45 area. So the fourth one, In the frontal lobe, guys, in the frontal lobe, we have the Broca's speech area. We have the Broca's speech area. And remember, it is area number 44 and area number 45. We have area number 44. Yes, Yeko Tom, good evening, attending from Uganda. Thank you for all the love that you guys are showing me. Yes. So I hope this is like clear. We are discussing the area number 44 and area number 45. Yes, we are discussing the area number 44 and area number 45. Right? So yes, can anyone tell me what is the area number 44 called as? Anyone in the chat box can tell me what is this area number 44 called as? Okay, I'm like waiting for your yes. Now, if you clearly see this, guys, if you clearly see this location, these both areas, they are present in which gyrus, guys? It is the inferior frontal gyrus only. These are present in which gyrus, guys? It is the inferior frontal gyrus only, right? It is present in the inferior frontal gyrus, and especially this 44 and 45. Sir, I'm using Snell Neuroanatomy, this book. Yes, it is very good, guys. You can just go through any of the books. Yes, Nashid. So now, Broca's speech area, let us just write the site first. Site. And remember, guys, it is the posterior part of, yes, the inferior frontal gyrus. It is not the anterior part. It is the posterior part of the inferior frontal gyrus, right? Yes, Blossom, very good, very good. Yes. Now, guys, in the inferior frontal gyrus, this 44, it is present in pars opercularis. Right? I have already told you what is this pars opercularis. Yes, you already know this pars opercularis from this diagram, this blue colored area, right? It is between the ascending and the posterior limb. And 45, it is between the anterior limb of the lateral sulcus and the ascending limb. And all this area, if you just see, it is in the inferior frontal gyrus. It is in the inferior frontal gyrus. It is in the inferior frontal gyrus. So remember, guys, over here. So this particular, it is the pars opercularis, and 45, it is pars triangularis. Pars triangularis, right? It is pars triangularis, right? Sure. Now, guys, now what is the function? Okay. Now, this area basically it is lying to near to the motor area of the larynx, tongues, and lip. So, okay. Now remember, guys, what is the function over here? What is the function over here? So as Blossom has already told, but yes, it is not the auditory one, beta, over here. Yes, it is not the auditory one over here. So I will be okay. Let us just try to write it down. It lies near to motor area of larynx, tongue, and lips, right? All together that are necessary for speech. All together necessary for speech. Necessary for speech, right? So remember, guys, it is incombinedly called as the motor speech area. Motor speech area, or it is also called as the Broca's area. It is also called as the Broca's area, guys. Now, guys, over here, if you see, guys, area with small numbers. No, over you have like multiple areas, that area 8, 6, 4. These all are having small numbers. And Broca's speech area, it is having 44 and 45. Can anyone tell me the reason why? Can anyone tell me the reason why some areas are given small numbers and some areas are given higher numbers? Can anyone tell me the reason why it is like so? Anyone in the chat box would like to appreciate this? Now, guys, whatever we have discussed up till now, the area 8, area 6, area 4. Okay, all these areas, guys, all these areas are the basic areas for the primary type of sensation, right? For our primary type of motor activity, I can say. Now, guys, these areas like 3, 4, 8, 6, they all are discovered earlier. They all are discovered earlier. So they were named earlier, right? So they have a smaller number like 3, 6, 8, whatever we have discussed. Okay, the most recent areas which are discovered, right? The Broca speech area or the advanced areas like the Wernicke's area or auditory sensations, they all are given high numbers, right? For example, 22, 28, 41, 44, 45. So basically, these areas which are given higher number are the areas which are discovered later on, right? And the areas which were discovered earlier were given like very simple numbers like 1, 2, 3, 4, and all that. So that is something you have to remember, guys. Right? I hope this is clear, guys. Even guys, a question over here that is I asked if this is injured, any lesion or injury, right? Any lesion or injury to this area, guys, injury to this area will result in motor aphasia. Okay, it will result in motor aphasia, or I can say Broca's aphasia, right? It is called as Broca's aphasia also. So that is something you have to remember about the Broca speech area. Very very important from the exam point of view. Dollar लगा लो इसमें दो तीन. Please put dollar over here. So yes, I hope this is clear. Just give me a thumbs up if Broca speech area is clear, where it is present, and in which lobe. It is the frontal lobe, and which part of the frontal lobe, inferior central gyrus, and which part of the inferior central gyrus. Yes, the one between the posterior and the ascending limb, that is pars opercularis, between the ascending and the anterior limb, pars triangularis, right? So please give me a thumbs up if this is clear to each one of you. Sure. Hmm. Now the next one, guys. Yes. Is it clear, guys? Chalo, Blossom, very good, very good. What about rest, guys? Yes. Now, there is one thing which like many books will not discuss. I mean, yeah, we have like other areas in the frontal lobe as well. So we have discussed like 4, 6, 8, 44, 45. Now we have like four areas over here, and that is the areas 9, 10, 11, and 12. We have 9, 10, 11, and 12. And guys, remember these 9, 10, okay, 11, and 12. Like 12 will like a little bit medial, guys. So that are the areas, these three guys, the 9, 10, 11, and we have 12. 9, 10, 11, and 12. These are prefrontal cortex. These are the prefrontal cortex. These are the prefrontal cortex. Now let us just try to write this. Then you guys will be like, it is in the frontal lobe only. So yes, the fifth one, it is called as the prefrontal cortex, and the area number over here, it is area 9, 10, 11, 12. 9, 10, 11, 12. Now guys, what is the side? It is in the remaining part of the lateral surface, right? It is in the remaining part of the lateral surface. Remember, it is the remaining part of lateral surface. Lateral surface of which lobe, guys? It is the frontal lobe. Of the frontal lobe, right? It is the remaining part of the lateral surface of the frontal lobe, and exactly the 12th one also extends to the medial surface. The 12th one also extends to the medial surface. तो वो आगे से तो देखेगा नहीं, right? Now what is the function, guys? What is the function? Very very important. Now what is the function, guys? It is concerned with control of conduct, control of conduct, behavior, also with the thinking process, and most importantly, it is the emotions. It is the emotions, guys. It is concerned with the control of conduct, your behavior, your thinking, and emotions. Right? Emotions. Right? Now, guys, if there is any injury over here, if there is any injury, right? If there is any injury to this area, now what will happen, guys? What will happen? It will lead to something called as the frontal lobe syndrome. It is called as the frontal lobe syndrome, guys. It is called as frontal lobe syndrome. Now, if it is controlling this behavior, okay, if it is controlling this behavior, guys, now what will happen if this area is like, if this areas are like having any kind of injury or there is any lesion in this area, this frontal lobe syndrome will be comprised of abnormal social behavior. There will be abnormal social behavior, right? There will be emotional disturbances in this patient, right? There will be emotional disturbances in this patient, right? And guys, remember one more important thing, that there will be educational, yes, regression. Because of this thinking process, there will be educational regression, right? So that is something that you have to remember. So I hope this is clear. The frontal lobe, guys, the frontal lobe, it is clear. All the areas which we have discussed in the frontal lobe, the 4, 6, 8, 44, 45, 9, 10, 11, and 12, which is on the medial surface. So just give me a thumbs up if you understand this part, guys. If you understand this part, just give me a thumbs up in the chat box. I'm waiting for your thumbs up, everyone. चलो फटाफट से एक थम्स अप दे दो, जल्दी से एक थम्स अप दे दो, सो दैट वी कैन लाइक स्टार्ट. यस, चल, very good. Pratibha Blossom, very good. What about rest, guys? What about rest? Yes. Now I will be focusing my discussion on the parietal lobe now. I will be focusing my discussion on the parietal lobe. Okay, perfect. What about rest, guys? All awake? Yeah. Sure. चलो let us now discuss about the parietal lobe. Parietal पीछे वाला lobe अब देखते हैं. Now, in this parietal lobe, guys, if I just want to like show you over here only. Yes. Okay. In the parietal lobe, guys, in the post-central gyrus, you will have like three major areas over here. 3, 1, and 2. This is how they are written. It is 3, 1, and 2. It is the 3, 1, and 2. That is the main sensory area or the somatosensory area. बीच में सेंट्रल सर्कस है, that you already guys know. We have the central sulcus. तो central sulcus के पीछे वाला part, the central sulcus is the one which divides into frontal lobe and the parietal lobe, right? The frontal and the parietal lobe. So before the central sulcus, we have the precentral gyrus, and in the precentral gyrus, we have this 3, 1, and 2 main sensory area or the somatosensory cortex, right? So let us guys. Yes, so let us guys just start with this. Yes. Just one moment. I am just checking my. Sure. Just a moment. Now, over here. Now let us we are discussing the centers in the parietal lobe. Okay, we are now discussing the centers in the parietal lobe. In the parietal, पीछे, I mean ऊपर वाले जो lobe से parietal lobe, right? Now over here, guys, remember we are going to discuss the very first, that is the somatosensory cortex. Somatosensory cortex, or I can say the main sensory area. We can also name it as the main sensory area, guys. The main sensory area, and you already know the main sensory area. It is 3, 1, and 2. The area 3, 1, and 2. Now guys, over here, remember, what is the site, guys? You already know the site. It is the post-central gyrus, right? It is the post-central gyrus. The post-central gyrus, which is on the lateral surface of the cerebral hemispheres, right? Now guys, what is the function of this? Can anyone tell me what is the function of this? Now, can anyone tell me what is the function of this? Yes, what is the function? Very, very important, guys. No book will write in such detail, but we will try to write each and every. I know it's not harm, guys, to write something like which is very, very important. So let us not like बिल्कुल भी कंजूसी नहीं करनी है लिखने में. So remember, guys, what is the function? It receives pain. First important thing, sensory area. So it will receive pain, guys, right? It will receive the pain. It will receive touch. It will receive proprioceptive or proprioception. Proprioception, right? Temperature. Even the taste, guys. The taste sensations, right? The taste sensations from opposite half of the body. From opposite half of the body, right? Now, you already know basically it is basically contributed by the pyramidal tract also 10%, right? But over here you just have to remember it is receiving the pain, touch, proprioception, temperature, taste sensations from the opposite half of the body. Yes, Blossom, very good, very good. Very good.